Hi, Mike. Good morning. This is your 1-week follow-up from your mini gastric bypass with Dr. Robert Rutledge. Do we have your legal permission to put your video on the internet?
Yes.
Okay, so do you want to tell us how your week has been and how your surgery went?
Surgery went well. There were some challenges for Dr. Rutledge, so we weren't certain how things were going to go once he got in there and started to perform the procedure. But all things went really well. Dr. Rutledge did a good job. I probably had a little more pain than the average patient because of the stents and some additional work that had to be done. But all in all, it went really well. I've been able to eat. Not a lot, and I've had to be real careful, but the food's been going down well, and I've been able to adapt to that pretty well. So all in all, I think it went pretty good. I'd say I'm relatively pain-free today, this being the discharge day. So all in all, I'm pretty happy.
So why was your surgery a little more difficult?
Surgery was more difficult because when I was younger, I had a surgery that was much more invasive, sort of chest to lower groin scar. And there's quite a bit of scar tissue in there, and so when Dr. Rutledge went in, he actually had to cut all that scar tissue to free it up to make basically space so that he could perform the MGB.
And so were you on any medications prior to surgery, any prescriptions?
Yes, blood pressure medication. I took 3 blood pressure medications, and I was also taking another medication for uric acid or for gout.
Okay, and how's your blood pressure been since surgery?
Blood pressure has dropped significantly. Right now it's still high, but that doesn't surprise me because my blood pressure was very, very high. But right now my blood pressure is where it would be if I was taking all of my medication.
Okay, so you're not taking any medication?
I'm not taking any medication now. It still would be considered high, but it's the same as it would have been if I was taking all of the medication.
Now, you said you had medication for gout. Have you had any gout symptoms after surgery?
I did have some gout symptoms. I worked with Dr. Rutledge, and we've got things under control. My expectation is that will be one of the last flare-ups that I have.
So how did you hear about the mini gastric bypass?
I had 3 family members that had the procedure done, all with excellent results and very happy with the results. They all recommended the procedure. My primary focus wasn't necessarily weight loss, but it was the blood pressure and the gout and the weight loss together that made this appealing to me.
Okay, thank you, Mike.
Thank you.